Hi, I'm Kelly. I'm the spa concierge at Kronos, and we're here to talk about medical weight loss injections today. And I'm going to introduce Judy and Luke, our nurse practitioners, and then we have Dr. Scott.
Hey, hello everybody. How you doing? My name's May Scott, Dr. Scott at Kronos. This is Judy. And most part, what they do is decrease stomach emptying, so you will feel full faster and longer. They also increase the insulin release from the pancreas and decrease glucagon release from liver. They both work in multiple different ways to really help you lose weight and feel satisfied. You're still going to enjoy food. You're just not going to be able to eat as much or want as much.
Key word, you're not going to want as much. It's awesome.
It's awesome. You feel good for the most part, with the exception of a few symptoms. For most people, we do write a prescription of Zofran to help with that nausea. But again, most people are having minimal symptoms. We're not seeing a lot of problems. Literally, out of the hundreds of patients that we've seen, we've only had one that hasn't been able to tolerate it. So it's very well tolerated.
So yeah, this just as a quick review of where these medicines came from. So my name's Luke Sinak. I'm a nurse practitioner. I have some experience. Been working at Ochsner Medical Center here in town, and I've worked with the endocrinology department for the past 4 years. And I mainly treat diabetes in the hospital, and I've been working with these medicines for years now. So these medicines started out with, for treating type 2 diabetes. And the reason why it works so well in our type 2 diabetes patient population here in town is not because it made their blood sugar better, but it helped them lose weight. And the way that it did that is kind of what Dr. Scott had already kind of initially opened up with, and that it slows your gastric motility. When you give this medicine yourself, it sends signals to your pancreas. Your pancreas then has a conversation with your abdominal GI system or your digestive system, and it tells your digestive system, to slow down. We slow the tempo down on your digestive system. So when that happens, like Dr. Scott was saying, you feel full faster. You eat less calories, which means you eventually will eat less carbs, which eventually means you will develop less fat. And so that's how this medicine really helps you to start losing weight. One thing I like to, this medicine, we call it the weight loss shot. And a lot of people around town right now is calling it the weight loss shot. I think it should be called more of an appetite suppressive shot, because that's really where this stuff works. This is not a fat burner. This is not an amphetamine, and that's the kind of the mechanism of actions a lot of old fat weight loss medicine gravitated around. Right, Adipex was a good example. The Teramine, I think, was another one, and those are all either an amphetamine or some sort of fat burn. Those class of medicines have, had some bad reputations of, having bad side effects, messing with the metabolism of your body. One great thing about these medicines is they're very safe. They were very safe for diabetics, and they're very safe for the general population as well. So back to the diabetes thing, it didn't make the patient's diabetics better because it was a lower blood sugar that we were chasing, but they lost weight, which then made their blood sugars lower. So that's how it has transitioned from the diabetes world of medicine into now that weight loss med spa kind of realm of medicine.
Now, there are three things we have to be cautious of. There are three contraindications. One is a history or family history of medullary thyroid cancer. Another, if you had a history of pancreatitis or gallbladder disease, those would disqualify you as a candidate. Also, in some diabetics, they are taking medications that would, be contradicted or contraindicated with these medicines as well. But for the most part, most anyone can use this other than those contraindications. Again, we're finding them to work so well and be so safe in the majority of patients. We do have several questions that people ask we'd like to go over.
They're asking them a rough estimate of price.
A rough estimate of price. Okay, people are asking us questions. Now, the good thing is, right now, one of these companies is giving a coupon to give this medicine away for the most part. They cost about $1,000 a month. Most people can't afford that. That is absolutely crazy. But one of these companies, Mounjaro, is giving coupons for the medicine for $25 a month. $25 a month. That's absolutely outrageous price. But
For right now,
this is a limited time, and from what we hear, they're going to stop doing this in June of next year.
We don't control the coupon. The drug company does.
Yeah, we have nothing to do with that. But so as it stands right now, it's an amazing price that you can get, a value, And the weight loss we're seeing is just incredible. The safety of these medicines is also incredible. There's been nothing like this before.
If I could say something, it would be the safety again. So this would be 3 times you're hearing how safe this drug is. It does not cross the blood-brain barrier. So you do not get central nervous system side effects like you would with the Adipex, like Luke was saying. It does not really have many drug interactions at all. It's a very safe drug for diabetics and non-diabetics through its mechanism of action.
Do we have any other questions? If anybody wants to ask a question, you can type it in. We'll try and get to it if we can see it.
When we come in, what happens with
Yeah,
the-
okay, so somebody comes in, initially what we're going to do is have a consultation to determine if you are a candidate for this medicine and how much weight you may need to lose. It's a very brief consultation. We get into a lot of detail about your medical history and why you would want to use the medicine. Also, we look at your medical record, look at the medicines you're taking, make sure there isn't, any kind of contraindication between the medicines you're using. But for the most part, there isn't. It doesn't really interact, as Judy was saying, with a lot of medicines. Then we would set the medicines or send the prescription to the pharmacy. Usually they'll have that ready in one day. The shots are easy to take. It's a pen. Do you have a sample of the
I
pen
do.
I can show you?
So this is the one that we're writing mostly right now because of the coupon Mounjaro. You just pop it off.
Pop it off.
You'll put it to some fat, unlock it on your skin, unlock it, press the button, hold the button down until you hear the click, wait 6 more seconds, take it off, toss it. You don't even see the needle in the Mounjaro.
And it's really painless. It's absolutely painless. It's really crazy.
So we're getting some questions about side effects right now. So side effects that we worry about. So when we slow down the tempo of the GI system, we do have to pay for that in some form or fashion. So what that looks like is this. So the first side effects we will ask in our consultation is, have you ever had a history of pancreatitis or medullary thyroid cancer? Both are very rare. However, when they started to design this medicine and they did all the studies, those were the 2 major problems that would arise. Very rare, however, it is worth talking about out loud. So let's review those 2. Medullary thyroid cancer, very rare, very slow progressing. It's something that would probably be more seen or caught on primary care screening of once yearly screening. So we recommend to all of our patients, if you don't have a primary care provider, we definitely want you to get one just so you can keep up with your annual screen.
This does not include, though, your regular hypothyroidism. You're
Correct.
okay with that.
Medullary thyroid cancer is a very specific type of nodular cancer in the thyroid that is, if you have it, somebody would have told you you've had it right now. If it runs in your family, it should be something that
Then
you're very well aware of in your family right now. Pancreatitis, a little bit more common, but still
inflammation of pancreas.
inflammation of pancreas. So anytime you hear itis in the medical field, that means inflammation. So this medicine works through the pancreas. So when you give a medicine in your body and it goes to the pancreas, or it goes to an organ, that organ will always reserve the right to get angry at you. So when you when you give this shot, and it's telling your pancreas to, have a conversation with your gastric system to slow down. And, sometimes pancreas can get inflamed. Pancreatitis is a very painful upper abdominal pain. If you've never had it before, you will remember it. And if you don't remember it, you must have been out or not awake. It usually, if it happens, it's severe upper abdominal pain, and it usually requires an ER trip with pain medicine.
To the ER.
However, no,
or to
those
primary care.
are extremely rare things he's talking about. Absolutely, none of you have had it. You would know it, and that's not what we're seeing as far as side
No.
effects. The side effects that we are seeing for the most part, the worst is nausea, and it's usually very minimal. Again, like I said before, we are writing a prescription for Zofran for those people who have it. Most people aren't even using the Zofran.
That's the most common side effect, and it's very manageable.
Very manageable. And occasionally people are getting some abdominal cramping. Usually that is minimal as well. I have heard of some people getting constipation as well, but that's about it. I mean, we're not seeing anything major occurring from this medicine. Now, the medicines, the injection that she showed you, you would take it once a week, and they
Same
comes
with
in.
this one.
Yeah, they're both the same. They're once a week. One of them you dial the pin up. The other one is just a single dose pin. You use it, throw it away.
So this is the Ozempic. It may come in a different color depending on your dose. You just open up the cap. It would have a little syringe cap on here. You just screw it on, dial it up to your dose, push it on your fat, anywhere, push the button down until you hear the click, and then count 6 seconds, take it off, unscrew your cap, throw your cap away, keep your pen. Ozempic has your whole month's dose in 1 pen. Mounjaro has each dose is 1 pen, so you get 4 pens.
So you take the dose in Mounjaro, throw it away. So you just get 4 pens in Mounjaro, 1 in Ozempic. 1 pen in Ozempic, as she's saying, has all the doses for the month. Mounjaro, much easier. 1 single pen, throw it away.
Okay,
Okay.
both once a week
Okay,
injection.
we have another question.
Yeah, do you have to meet certain criteria?
Do you meet criteria? Yeah.
It's very personalized, which is why we have you come and do a consultation. We want to see the white in your eyes. We want to talk to you. We want to talk about eating habits. We want to talk about your relationship with food and your relationship with your weight. The biggest contraindications to taking this medicine, we just reviewed the pancreatitis and the medullary thyroid cancer. At that point,
Pregnancy and breastfeeding.
yep,
Yes.
and pregnancy and breastfeeding, we stay away from this medicine. Other than that, it's very safe medicine. You
How
asked,
long do we have to
how long?
take it? And
How long do you take it? Well, you take it until you lose the amount of weight you would like to
what's the
lose,
limit?
as long as you're not having any significant side effects. Now, it's something we want to control. So basically what we're going to do is see you as an initial consult, set you up to take the medicine, and then we want to see you once a month to make sure that you're not having significant side effects, and at the same time determine if you need to move up to the next dose if you're losing a significant or the sufficient amount of weight. If you're not losing enough weight or you plateau, that's when we increase your dose or change your dose. Now, how long will you take it? Again, until you lose the amount of weight you need.
Once you get there though, you would want to keep it off. So you would want to get with our nutritionist or a nutritionist to have healthy eating habits. I mean, this is what they went to school for. They have a variety of meal planning and meal prepping. We all know how to diet, but we don't really know how to implement it. That's what they're there for.
That's hard in Southern Louisiana.
Yes.
Very hard.
So
Once you're off the pen, it's out of your system in a week. So you're going to start re-eating again. And you want to put healthier options in your body. But if you want to get back on the pen, you can stay on it indefinitely. We have diabetics on it indefinitely. I do primary care on the side. I have diabetics and non-diabetics on it indefinitely.
yeah,
okay, so I want to back up just a little bit. So we were talking about how long have these medicines been around. So this class of medicines has been around for a very, very long time. Since I've been treating diabetes for the past 4 or 5 years, I've been using this class of medicines very, very frequently. This class of medicine is nothing that anybody in this conversation needs to remember right now, but it's called a GLP-1 agonist. And all that means is it works in the pancreas. So there's been a lot of different versions of this class of medicine for years. So these medicines have technically been around for a very long time. Common names that you might recognize or that have been commercials: Trulicity, Victoza, Brilinta was a popular one at one time. Ozempic has been the most popular recently, and now the newest one on the market is Mounjaro. And so Mounjaro is the new updated version of Ozempic, is how I like to explain it to people.
But either way, you're going to lose the weight on
Right.
either one of those two.
So they all do the same thing. So when we talk about dosing, okay, and we talk about what's the right dose for you, what's the right dose, when these medicines were designed, okay, and I want everybody to kind of go back to what we initially started talking about right now, appetite suppression. Okay, so when you take these medicines, we start you off when you come in for a consultation, and our initial consultation is anywhere from $350 charge just for the initial consultation. And we start you off on a dose, and it's a low dose. I like to call it the loading dose. Okay, and this dose is really just to get your body used to the potential side effects that you might have. On average, as Dr. Scott and Judy were saying, the side effects have been very, very minimal in our patient population. Our most popular one, with my patients at least, has been bloating, acid reflux. Lasts a couple of days. By the second week of injections, it's very tolerable and nobody's had any issues. So that you do that for a month. And in that month's time, we're not really necessarily looking for weight loss. Okay, we're really trying to get your body used to this medicine and try to decrease the amount of side effects.
But you will still lose some weight.
Some people have been losing weight. I've had some patients lose 10 to 16 pounds on the first month of dose. Now, I'm not promising that to anybody.
We had one guy lose 18 pounds in the first round. Now, the important thing to know, though, is the higher the dose does not necessarily mean you're going to lose more weight. You do not want to increase your dose just to increase the dose. If you're losing weight at the lower dose, stay on the lower dose, because the side effects are dose dependent. Side effects will increase with increased dose. So that's what we're here for, is to help guide you through this and make sure you're having the least side effects and the best chance of weight loss. And honestly, the way it does work for weight loss, the longer you can stay on the lower dose, the better chance you have to lose more weight, because increasing to the higher dose does not necessarily, again, mean that you're going to lose more weight, but your body can become accustomed to it, and you may stop losing weight at that dose and have to continue to move up to the next dose and the next dose if you move up too quickly. So what we want to do is work with you to find the best dose and then move you up as needed to keep you from having too many side effects and lose the
Off
best.
topic from this, but going back to just the cost of everything, the initial consult is $350, but the follow-ups are not $350.
Yeah, we're not going to make you pay $350 every time you come get us.
And we're probably, first we're going to keep you coming back every 4th week to make sure that we have you on the correct dose, that the side effects are manageable, that we're having what we want both you and I have, in a safe way with the weight loss that we're looking for, with everything going kosher. Once we get that, then we can go on to a maintenance thing where we don't see you every month. So it's less money, and it's not going to be as frequent as time goes on.
And yeah, as it stands right now, these medicines the companies are giving rebated pricing, and it's extremely tolerable right now.
Exactly.
Especially Mounjaro, which we can get right now for $25 a month, which is incredibly low.
That's pretty much giving it away.
Yeah, but this is limited time. Like we said, we don't have any control over it.
We don't.
If you want to speak to someone here, if you want to have a consultation, our phone number is 504-267-4549. Call at any time and set up a consultation. But these drugs are really well tolerated.
What's the phone number one more time?
That was fast.
504-267-4549. So honestly, everyone here is very, very knowledgeable about the medicines. We have been using it and doing it. Our staff have all been taking the medication, and we're seeing very few problems with it.
And we've been
fantastic.
using it outside of this too with diabetics for a very long time, for years.
Yeah. Okay. So anyway, if you're interested, if anyone has any other questions, anybody sending in questions?
So we're getting some questions more about dosing, and I want to just go over that a little bit right now. So yes, we start you off at initial dose. Okay. And that initial dose, it's very important that, we decrease the amount of side effects, and the company has even recommended this. So with all these class of medicines, these GLP-1s, they always recommend you start off at a low dose. And even when this was just primarily a diabetes medicine, I always told my patients, this first month of dosing is not going to do anything for your blood sugar. It's to get your body used to the medicine. So I tell my patients in our initial consultation, this is a 2-month commitment if you decide to keep going with this. So the first month, we just want your body to get used to the dosing, and it's very important that happens. Now, if at 2 weeks you have had no side effects and you're feeling fantastic, we can have a conversation to move you up to 5 milligrams. After the first month, we have you come back for the second refill, or the first refill visit, which is the $99 visit, and we have a conversation. We take your weight. Okay, I'm going to ask you about your side effects and how you're feeling, and I'm going to, we're going to count your weight if you've lost any weight. Now, the first month of dosing, like I said earlier, I'm not promising any major weight loss. So what I do tell people, some people get 5 to 16 pound weight loss. On average, my patients have been telling me they're getting a 3 to 6 pound weight loss. But what I'm telling people is whatever you lose in that first month, get from the gods. Second month, we moved you up to 5 milligrams, and this is where this medicine is really the most therapeutic at this second dose. So at 5 milligrams, at the end of that second month, I'm really going to be more interested in how much weight have you lost and where are we at with our side effects. And at that point, do we make a decision? Do we stay at 5 milligrams? Do we go up to the next dosing, or do we go down if you're having side effects to a lower dosing?
Well, that really depends. We do not always move everybody up to 5 milligrams right away. It really depends. If you are losing 12 pounds, 10, 12 pounds at the first dose, that's really where you want to stay until you start plateauing. The thing is that the medicines are very, very well tolerated, and we don't want to cause any side effects. And the weight that you're losing with the lowest side effects is exactly where we want to be.
And this is why we have you come back. Here at Kronos, we really do individualize it to the patient. So we're not trying to push anything or pull anything on a blanket mass label. We really do personalize it to the patient and what's best for you.
Somebody just asked about the coupons and how you get the deal. You don't have to worry about that. We take care of it for you. We are going to make sure that you get the best price on the medicine as possible. We're constantly in touch with pharmacies in our area and outside of our area to try and find the best possible deal for the patients. All we do is a consultation. We're just charging for consultations, and then we find the best price for you. If you want to go down the street to Walmart or Walgreens and pay $1,000, we'll send the prescription to Walgreens and Walmart, but that's not what our patients want to do. So we're going to give you every option we can to get the best price that we can possibly do for you.
Another question we're getting at diet and exercise, and I want to start. Diet and exercise are just as important as it has ever been when we're talking about weight loss. This is not a shot you're going to take, and in 2 months you're going to look like a supermodel. Diet and exercise still plays a part. It very much plays a part. What I'm trying to tell my patients to do is, if you've ever tried to be on a diet, or if you've ever tried a diet and failed at the diet, I've had plenty in my lifetime. Now is the time to change your eating habits, because when you start taking this medicine, we're looking for appetite suppression. And when this appetite suppressing happens, it's going to be a lot more easy to tolerate a better diet, a better eating habit. And then we need to make a habit out of that. And once your habits are set in stone and this muscle memory and your relationship with food changes, if that day comes where they take this Mounjaro, $25 wonderful coupon away, and you decide that you don't want to pay the out-of-pocket cost, which is going to be very expensive. It follows the same trajectory as Ozempic did. I'm hearing $1,000 to almost $1,700 a month for Mounjaro once they take this away. If that day comes and it's not something that you want to keep paying for, you'll already have those eating habits and those exercise habits set in stone. So this is a perfect opportunity to change your eating habits.
Makes it important to go with the nutritionist and get those habits really cemented down with a good foundation.
Like they're saying, we do have a nutritionist who's fantastic. We work with Marcy. She's absolutely amazing. She's been working with our patients long before these shots came along. And we offer this to all of our patients to make sure they have the opportunity to find better habits and a better way of taking care of themselves without needing the injection. But we will continue to offer the injections beyond that for maintenance. And we will be able to find better pricing than in pharmacy.
It's not going to be $25 when the coupon expires, but
We'll stay one step.
But there is.
Yeah, we try to stay one step ahead of whatever the market price is around town.
And that's always going to be available. Anybody else have any other questions? Anything?
Not currently.
No?
I know that I've noticed with people that menopausal women who have the fat that they just can't shake, it's been really helping jumpstart it for them. Alcohol was a big question that I get a lot. They really need to go for a third FDA approval for decreasing alcohol cravings, because this is both of these. For some reason, your alcohol cravings are decreased, I guess because your food cravings in general are decreased. So you just listen to your body. You're not going to be drinking as much. And it's not going to be a fight in your head against it either.
Yeah, it works. It's amazing how well you feel taking medicine. Do we have anything else?
Another quick question. It's $25 for the month of supply right now.
For a
So it's
4-week
not
month.
$25 a shot. It's $25 for four
4
shots,
weeks.
for 4 shots.
It's amazing because it's initially it has been $1,000, as they said, $1,000 to $1,700 a month. And right now for the next till
I don't
again
know when.
June, we heard
June
until
2023.
June 2023, it's $25. It's amazing. So look, if any of you are out of our direct area, they don't do, but I can do a virtual consultation or a teleconsultation. And we do have a pharmacy also that will ship overnight to you still at $25. That's it. We found a pharmacy, a local pharmacy that will ship anywhere in Louisiana for $25. That includes shipping. There's no charge for that. Oh, yes, and this is something that's recorded. You can watch anytime, as I'm hearing from
Yes.
the sideline.
This
Anyway,
drug is a great drug. It's not a gimmick.
no, it's not. It's fantastic.
It's an amazing drug. It's a wonderful drug. It's a
We have-
safe drug.
Is one better than the other? That's a good question.
Supposedly Mounjaro is, you're going to lose weight on either one of the drugs.
A lot of my patients have been, from what I'm hearing from my patients when I ask them about the side effects, I'm getting Mounjaro's winning on the side effect profile right now. So I'm getting less side effects with Mounjaro prescription patients as opposed to my Ozempic prescription patients. Again, everybody's a little different on both medicines. Even with the Ozempic having more side effects, the side effects were still mild and didn't last long, maybe a week. By the time you're done with your first or second injection, everything has leveled out and it is very tolerable. That's about it.
Yeah, that's it. Mounjaro, as he's saying, is so far it looks like it may be slightly better, and the weight loss is slightly better in the studies. Not a whole lot. Both of them work, and they work very well. The side effects are usually, for most people, minimal in both medicines. But do remember that Mounjaro is not approved for weight loss at this time. They're working on approval. Ozempic has been approved.
Bet money, they're gonna get it.
They're going to get it, of course. Ozempic has been approved under another name. They've taken the same medication and rebranded it in another name, Wegovy. And Wegovy has been approved for weight loss, which is
Exact same medicine.
Same medicine.
Exact same medicine, marketed differently.
Does the energy level drop? That's a good question. In some patients, you can have a little decreased energy because of the decreased carbs you're taking in. That usually doesn't last.
It's indirect. It is not, they do not cross the blood, the drugs do not cross the blood-brain barrier. So it's nothing going onto your brain telling you to be tired.
Yeah.
You decrease your calories, you decrease your energy. If you go down to eating maybe 1 meal a day or a little bit more, and it's carb heavy, you're not following it up with more carbs like you normally would. So you're going to get that carb crash.
Mhm.
So try to eat a very balanced meal for your big meal, such as cheese, fish, avocado, nuts. You can still have carbs, just try to keep it more healthy fat so that you have more of a balanced energy with what you are putting in your body calorie wise.
Yeah, if you would like to, again, if you'd like to make an appointment, call our office. We're open from 10 o'clock until 6 o'clock at night. That's 504-267-4549. We do have appointments available. We are pretty booked up, but it may take a week to get in, but usually not that long. And we do have occasionally have patients drop off, so some people can get in, same day, or yeah, we'll fit you in. Anyway, so we hope we've given you a lot of good information. These medications are incredible. They're very, very well tolerated overall. They're very safe. So if you have any questions, please come see us. Call us again, 504-267-4549. Hope you're all doing well.
We have recorded this meeting, and we will be emailing out a recording of this with all these questions and answers. If you
Thanks for joining us.
All right, thanks, guys.
Good night.